After a decade of being polio-free, Ghanaians woke up to the news that a routine surveillance had detected a new strain of poliovirus in the sewage called circulating vaccine-derived poliovirus type 2. This was revealed at the launch of the National Immunization campaign by the Ghana Health Service in Accra on Wednesday. The campaign was to see to the vaccination of all newborn babies and children under 5 years, whether vaccinated or not.
In 2021, as I presented, we were fine. Unfortunately, we've had another importation, and this is why we are doing this. We had, as part of the polio surveillance, we do environmental sampling. So from time to time, we sample the environment to see whether we have the virus in any sewage sample. So we had that. And then whilst we were preparing to respond, a child got paralyzed. And so that was the first case. And then yesterday, we had an additional paralysis from northern region again.
Deputy Minister of Health, Mahama Sani Ase, reassured Ghanaians that the novel oral poliovirus type 2 vaccine was safe and urged parents to ensure that children under 5 were vaccinated against the disease.
To inform this August gathering that is a new tool on the block to fight polio, and Ghana, together with partners, will deploy the novel oral poliovirus 2 version during the campaign. The Ministry of Health, in cooperation with the Global Polio Eradication Initiative partners, will organize 2 rounds of vaccination campaign against polio for children who are less than 5 years with the NOPV2 as follows. The first round, 1st to 4th September 2022, second round, 6th to 9th October 2022.
Assessing the 4-day vaccination exercise, Dr. Kwame Amponsah says the first phase, although fraught with slight challenges, was successful.
Yeah, well, so far it's been quite good. The gallant volunteers and health workers have done a yeoman's job. Of course, we've had a few challenges here and there, but these are not unexpected. So after and when we get them, we try to surmount them and move on. From what we have observed and from the reports coming from other areas, we don't have that kind of problem. Of course, occasionally you may meet 1 or 2 people who, I wouldn't call them being hesitant, but they are not totally informed. So once we try and get them well informed, they vaccinate. I mean, they get their children vaccinated. For both phases, we are vaccinating approximately 6.3 million children under 5. And it's the same thing we'll do for the second phase. It's 6th to 9th October. I would urge all Ghanaians, especially caregivers, to make these children available so that we don't, as I said, get a lot more people getting paralyzed from polio. Polio is a very deadly disease. It leaves children mostly paralyzed for life.